My name is Julie Chavez. I grew up in Roswell, New Mexico. I work as the Director of Respiratory Services for Eastern New Mexico Medical Center, which is based in Roswell, New Mexico. For Director of Respiratory Therapy, I manage the department where the respiratory therapists work. So I am responsible for making sure they have the supplies that they need, the equipment that they need, the staffing that they need in order to make sure the patients are taken care of. If I wasn't there to do that, then they wouldn't have the resources that they need to do their job. Not all the time, but I do back up my respiratory therapist. So if the patient acuity or volume is high, or if someone is sick and not able to come to work, then I will step in and help take care of patients alongside the people that I manage. So a respiratory therapist has a huge variety of responsibilities. We take care of patients from, especially in a rural community, we take care of patients from newborn all the way up to end of life. We also are responsible for collecting blood, specialized blood called arterial blood gas that helps tell more of the ventilatory status of the patients. We are present during conscious sedations for patients that are getting sedation because they need some sort of splinting or reduction of a dislocated limb. We will assist with something called a bronchoscopy, which is more of a diagnostic procedure, but it can be therapeutic, in which they introduce both a camera and suction into the lungs to either get material for diagnosing the patient or to help the patient clear out secretions. There's also a further diagnostic portion of respiratory therapy where we do pulmonary function testing, something called electroencephalogram. Some respiratory therapists are trained to do, which is a neurodiagnostic portion. Also, respiratory can do polysomnography, which is sleep studies for people with sleep apnea. So there's a wide range. We can work in home health, we can work in the hospital, we can work in doctors' offices. Some respiratory therapists in larger cities are on the flight crew. So there's a lot of avenues for career paths for people. So initially, when I was in high school, I knew I wanted to go into the medical field, so I was really invested in STEM classes, my biologies, my chemistries. We actually had a sports medicine class an anatomy class that was more in depth. So that kind of triggered my passion for the medical field. And how I grew up, there was not a lot of financial resources. I did well in high school, but scholarships were not heavy on the ground. So I graduated with my associates and I started working here locally at Eastern New Mexico Medical Center. I started as a floor therapist, which again, taking care of neonates on up to people at end of life. And through the course of that, I was offered the opportunity to do on-the-job training for EEGs and PFTs, which you learn a little bit about that in school, but it's more, the training comes after you graduate for those particular job descriptions. Almost 15 years ago, I was offered the opportunity to be the lead respiratory therapist in our department, which offered me additional responsibility for overseeing the department. I did still have a director above me, but I was kind of the day-to-day go-to person. And while that was going on, I also went back to school, and while I was working full-time, obtained my bachelor's with an emphasis in business management, because although in the medical field, clinically, you need to know what you're doing. In a managerial position in the medical field, business is also a helpful focus. So you understand how to converse to get what you need from non-clinical leadership. So I got my bachelor's, and I was then given an official lead position, which came with a raise. And then last year, about February, I was promoted to the director of the respiratory department. You can read a lot, but I was fortunate to have teachers that were kinesthetic, hands-on teachers, and because that's where I learn best is hands-on. So reading about the body and how it functions really was ignited when I had a teacher that it was my sports medicine teacher. He liked to do a lot of hands-on presentations. So he would do experiments where we watched the contraction of the muscle through electrical stimulation. My biology teacher, my AP biology teacher, she was phenomenal about letting us do dissections. We saw they were pig lungs at the time, hearts. I was just fascinated by anything anatomy and physiology, and I was very fortunate that the teachers that I worked that I studied under had the foresight to let a lot of us use our hands-on approach to learn and kind of spark the fire that took us further. You can make a huge impact caring for somebody in the medical field. And the beauty of nursing and respiratory therapy and a lot of the entry level positions is that you can go to a community college. You can save your money by staying closer to home for those 2.5 years, 3 years that it takes you to get that degree. And then once you get that degree, it opens up so many doors and so many opportunities just to grow and set yourself up financially without having had gone into debt quite a bit through college to get that degree.